The title of our presentation is From Trauma to Treatment, a literature review on the theorized effectiveness of trauma-focused cognitive behavioral therapy on juvenile offenders living with post-traumatic stress disorder. We are Anastacia Viau, Emerson Heller, and Ella Clark. Our faculty advisor is Dr. Sarah Bielik, and we are part of the School of Professional Psychology at Wright State University. Research indicates that approximately 66% of young men that are in the criminal justice system have at least one mental health disorder, and about half of youth in the system have PTSD. This is important as rates of comorbidity of PTSD with another mental health disorder have historically been around 80%, but this number jumps to 93% if they are an adolescent in the juvenile justice system. This population is often faced with histories of abuse and neglect, parental criminal history, and unstable living environments, which could all play a role in traumatic events. And when trauma is untreated, this can lead to poor decision-making, maladaptive coping mechanisms, and can increase their risk of either justice system involvement or recidivism if they are already involved. Significant long-term mental health challenges are also of concern. Therefore, treatment is very important here. There is increasing recognition of the high rates of trauma with justice-involved youth in the juvenile justice system and has led to a call to action within the juvenile justice setting.
While routine trauma screening now occurs in juvenile justice settings, very little is still known about what treatments are effective to use with this population. Trauma-focused cognitive behavioral therapy, or TFCBT, research has been established over the years to show its effectiveness in reducing trauma symptoms in both children and adolescents. However, there is still a significant gap in the research that looks at the intersection of PTSD, TFCBT, and incarcerated juveniles. The aim of this literature review is to use previous research on children and adolescents with trauma to advance the argument that TFCBT can be effective for incarcerated juveniles with PTSD. Some key findings from our review found that research findings consistently suggest that TFCBT leads to positive outcomes, including the decline of PTSD symptoms, improvements in emotional regulation, decreased substance abuse, and improvements in distress related to relationships. Trauma-specific interventions, including TFCBT, have also shown to significantly reduce trauma symptoms in detained youth. Finally, meta-analytic data suggests that TFCBT has a larger effect size in addressing delinquency and problem behaviors compared to CBT programs that are not explicitly labeled as trauma-informed.
In conclusion, while there are studies focusing on youth involved within the criminal justice system, where CBT-based interventions were shown to be effective for a variety of aspects, including skills building and emotion management, they did not focus specifically on the reduction of PTSD symptoms. Across the literature, utilizing a trauma-informed approach for justice-involved juveniles is shown to have potential benefits, and treatment programs implementing it are likely to be effective. TFCBT has been supported in environments such as foster care and orphanages, which helps suggest that parental involvement is not necessary, which is an important piece to consider with the correctional environment. Due to the connection between trauma histories and later delinquency, this research strengthens the argument of the benefits of TFCBT with this population. Future research should be focused on the utilization and referral of CBT-based interventions for juveniles within the justice system and should be expanded upon for vulnerable populations, including those already within the system and those who are at risk. Thank you for listening to our presentation today. Here is a QR code to our poster and to our references.